My name is Shelby Nicholson. I'm doing my IV checkoff today. Here's my ID, and then I'm going to do a room scan. So the first thing I would do when I went into my patient's room is I would introduce myself, and then I'm going to check my hospital policy and my order, and then I'm going to perform hand hygiene and identify my two patient identifiers. So I have Jaguar J. Jones, date of birth 08/25/1963, date of birth 08/25/1963, hour just penicillin, hour just penicillin. I would explain the procedure to my patient, provide privacy, position my trash can, which I have here, and don my goggles. And then I'm going to perform hand hygiene, raise my bed to working height, lower my side rails, position my patient comfortably, either supine or sitting. And then I have all of my equipment gathered. So I'm going to go ahead and take my catheter out. And I have my dressing. Today I'm going to be using saran wrap to simulate my Tegaderm. So I would take it out of the wrapper, and it would obviously still be sealed with the adhesive. But so now I'm going to move that, and I'm going to go ahead and clean my saline lock. I'm going to clean the cap with my alcohol swab, and I'm just going to clean on that, make sure not to touch it because it is sterile. Throw that away, and then I'm going to go ahead and connect my syringe. And I would make sure not to touch that inside part because it is sterile. So now I'm just going to twist it on there. So now this is when I would loosen the cap. I would loosen this cap, but I did lose my cap at the skills lab. So I would just loosen the cap, but I would make sure that I didn't touch that inside part because it is sterile. And so now I'm gonna put it back in its container. So now I just wanted to identify that I believe my finger did kind of skim the top of the syringe under the cap, so breaking sterility. So now I'm gonna say the three ways to find a good vein. So you don't want to you want to use a non-dominant arm, and you want to find the most distal point as possible, and then you distal points. And you want to find a spongy, bouncy vein. And then the three ways to foster venous distension is you're going to want to stroke the vein lightly, apply warmth to vasodilate for several minutes, and then get the patient to open and close their fist if they can. So after they do that, you can hopefully find a good vein. And so after you found your vein, you're gonna get your tourniquet. And I also forgot, before I do that, I'm going to prime my tubing. So there we go. So now I'm gonna put it back in there. So now you're gonna get your tourniquet, and you're gonna put your tourniquet on 4 to 6 inches above the above your insertion site. Okay. So now you're gonna want to get your. Before I do that, I'm gonna put my gloves on. Okay, so now I'm going to get my chlorhexidine. I'm going to push in the sides to activate it, and I'm going to clean vigorously in a vertical and horizontal and circular motion. And I'm going to do that for 30 seconds. Like I said, I'll do that for 30 seconds. Then I'm gonna dispose of that. So now I will let that dry gonna get ready to insert my catheter. I'm not gonna touch where I have just cleaned, but I am going to stretch the skin 1.5 to 2 inches above where I clean, and I'm gonna stretch it in the opposite direction of the vein. So I'm gonna take my cap off, and then I'm going to make sure my bevel is up. And so I'm going to stretch my skin, and I'm going to insert the catheter at a 10 to 30 degree angle. So I'm going to go in. I'm going to assess for blood return. Once I see that, I'm going to lower my needle, and then I'm going to continue 1/4 of an inch advance. So now I'm going to apply pressure right here. Or no, I'm sorry, not yet. Not yet apply pressure. And then I'm going to push my hub down, and then I'm going to push and pop. So I'm going to pop my tourniquet off. Now I'm going to apply pressure with my pinky, and I'm just going to take my salad out, go straight to the sharps container, and I'm still going to hold my pressure, and I'm going to hurry and attach. This is when I would open the cap all the way off, and I would do it without touching the inside. The inside, that's what's going to be going in here. And then I'm just going to twist it on there. Okay, I'm still going to be holding my pressure. I'm going to get my temporary tape, and I'm going to tape it on. Okay, and now I'm going to aspirate for blood. Okay, and after I did that, I would push all of the remaining saline into the vein. And next, I'm gonna disconnect this. That's gonna go in the sharps container. And so now I'm going to apply my dressing. So I'm going to get my dressing, and I'm gonna do my dressing. So I'm gonna get this, and I would not touch the transparent part, and I would take the protective layer off, and then I would put it on here, and I would make sure that it wasn't covering the hub, and then as I removed the tape from the sides, I would make sure that it was smoothed down. So as I removed the tape, I would go behind it and smooth everything out, make sure there was no bumps in it or air pockets. And I'm gonna keep going around the sides. And with the saran wrap, there is a few air pockets because it's not sticking well, but then I would take an extra piece of tape, and sorry, this moved. I will take an extra piece of tape, and I'm gonna write on it. I would write my, let me set that on there. I would write the gauge, my initials, the time, and date. Okay, and then I'm gonna put it on the side of the dressing. I would not put it over the hub or over the entire dressing in the middle. And so there we have that. And now I'm gonna permanently tape this. So I'm gonna hold it steady, and I'm just gonna remove this temporary tape, and I'm gonna put permanent tape on there, and I'm gonna let the tubing naturally, the way it naturally folded. So there's my IV insertion. So I would lower my bed, raise my side rails, leave the patient in a comfortable position, and I would teach them 3 ways to prevent IV dislodgement. So I would ask the patient to protect, they're going to want to protect their IV when they're moving, and then when they're going to the shower, they're going to want to wrap it up, and then make sure that that is always taped and secured to their arm. And when they're moving, make sure that everything that they're hooked up to is unhooked when they're like moving, or at least what they're hooked up to is moving with them. And then the 3 signs for IV complication is inflammation, infiltration, and phlebitis. So then when I document, I'm going to document how the patient tolerated it, the date, the time, the gauge, if there's anything flowing through it and what rate it was flowing through it, and the number of attempts it took for me to get that vein, and then how the patient, if I saw anything abnormal or anything like that. So, but before I went and documented, I would take my gloves off, take my goggles off, perform hand hygiene, and I would dispose of all of my equipment. I'm going to keep my gauze right here though, because I'm about to use that. Alright, so I would leave my room, and so to discontinue, I have my goggles, so I'm just going to put those on, and before that I would perform hand hygiene, and then I'm going to put my gloves on. Okay, so I'm going to go in and I'm going to tell them that I'm discontinuing their IV. So now the first thing I'm going to want to do is remove the old dressing. So I'm just going to start from the edges and move towards the center, and I'm going to go all the way around. And pull the edges into the center. I'm just going to move that. Okay, and then remove. So I'll throw that away, and then I'm just going to assess the site, see if there's anything going on, and then I'm going to take my gauze, and I will get 2 gauze. I'm going to place it right above the insertion, and then I'm going to remove my tape. It'll come off. I'm going to remove my tape, but I'm going to make sure to hold it steady, and then I'm just going to apply a little bit of pressure and pull it out parallel, and I would assess the catheter tip to make sure it was intact, and see if there's anything anything abnormal, and then I would throw that into my sharps container. And I would apply pressure for 30 seconds. Some people who are on anticoagulants need to have pressure held for 5 to 10 minutes or even longer. So after that, I'm going to take my tape, and I'm going to tape it down. Okay, and just like before, I'm going to make sure my patient is left comfortably. And while I was doing that, I would assess the site, see if there's any signs of drainage, abnormality, possible infection, swelling, any of that. And then I would go document. But before discontinuing, if my patient was hooked up to any kind of fluids or anything, I would make sure to disconnect that before discontinuing. But yeah, I would remove my gloves. And then remove my goggles, lower my patient's bed, raise side rails, make sure that they had the call light, and yeah.